and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwarz, licensed midwife and MC for Gold, and with me today is Dr. Helen Hurst. Welcome back, Helen.
Hi, nice to be here.
It's wonderful. You're going to speak for our add-on package that is titled Postpartum Care in Practice, Clinical Strategies for Physical and Emotional Recovery. It's a great add-on package. It's brand new. And your presentation, a very important presentation, is titled Beyond the Bleed, Postpartum Hemorrhage Prevention, Recognition, and Response. And Helen, it's lovely to have you back here. Tell us just briefly about your background.
So I am a labor and delivery nurse. I feel old in saying that I've now been doing this more than 30 years. A labor and delivery nurse, and I was also a certified nurse midwife. And I worked in as a midwife, I worked in a rural practice in South Louisiana, and my whole life was in labor and delivery in the same hospital, my whole labor and delivery career. But I'm originally from England, so I love that I get to talk to see people from all over the world, and you and Canada and licensed midwives and nurse midwives and labor and delivery nurses. But my love is absolutely delivering babies.
Wonderful. Yeah, well, thank you for sharing that. And you are also, and your second love is education, right? You're a great educator. You love teaching and educating
Yes.
on, and especially obviously on topics here about obstetrics care. Now, your topic is about hemorrhage, right?
Hmm.
And I feel like this is one of those topics. Yes, we learn this, of course, in midwifery nursing school, where, and we deal with this on a quite fairly, I wouldn't say regular basis, but of course, it's something we need to be prepared for. We need to be ready for. And still, I feel like, why is there still so much? Why is this still happening? I mean, this should be something we should be like,
Yeah.
okay, this is, we
Yeah.
got this,
I think
Helen.
I think what the evidence and the research is starting to show us that
Mm,
we still just don't know a lot. We know a
mm,
lot, but not enough.
mhm,
All in the presentations I talk about, the risk assessment tools. We know that these risk assessment tools are still not accurate enough in providing care, with 40% of women never been identified as being at risk for postpartum hemorrhage, but having postpartum hemorrhage. So I think
mm,
everything is still evolving related to that. We don't know what is the right combination of drugs. We're changing what we consider postpartum hemorrhage. From now looking at that cumulative blood loss in the first 24 hours after birth as
mm,
being greater than 1,000 cc's as postpartum hemorrhage, knowing whether, suggestions from the literature that we need to look at, should we be titrating oxytocin dosage differently for vaginal birth than we do for C-section. But I think the key thing that these risk assessment tools, we kind of, I know when I got out of nursing, so it's like the gold standard. Oh, well, if they were induced and they're a gravida-5 and they're having twins, then they're automatically going to have a postpartum hemorrhage. But this primipara who has no risk factors is going to
mm,
have this beautiful birth and it should be fine. So I think it's more really recognizing now that we have to be ready at any birth.
mhm.
And
Yeah.
I don't know that the focus of education is always on postpartum hemorrhage. We do a lot looking at shoulder dystocia. We do a lot looking at,
True.
those other high risk things that
Yeah.
can happen where postpartum hemorrhage, although we know that it has such a high impact on maternal morbidity or mortality, I still don't think we think, oh yeah, well, we know that. We know what to do. But there's still
Yeah,
so
right.
much to learn.
And there is so much to learn. And you mentioned something that is, I feel like, very important here too, the low risk, right? Like the low
Yeah.
risk clients that we have, and we're expecting this butter birth.
Hmm.
And one of your, was it you, Helen, or one of your colleagues called it midwifery?
Oh, I hadn't
That
heard
you,
that one. Midwifery. We wish
yeah,
that it won't
midwifery is
happen.
saying
I
like,
like that.
we have a low risk client, we expect this butter birth, right?
Yeah,
And we want this butter birth. And here's the deal, we don't want to interfere too early
correct.
either, right?
Yeah,
Like we want to
yeah.
be kind of the watchdogs for of normal. We want to be there,
Hmm.
but it's always that delicate dance. We don't want to
Hmm.
jump into something and
Hmm.
when it's not necessary, but we need to be ready when it
Hmm.
is. So talk to me a little bit about that kind of that balance
I
that
think the
we maybe
balance. I think we can help that by discussing it with our clients beforehand. I think,
Mm-hmm.
one thing we don't talk about when we talk about childbirth preparation, we kind of talk about the rosy glow, right? But
Mm-hmm.
I think we can manage those expectations if we can say, look, just so you know, we're going to be watching for this. This is why we
Mm-hmm.
might want you to get out of the tub sooner so we can really quantify how much bleeding you have. This is why you might not want us to take your vital signs really frequently because you feel okay, but this is why we might need to do
Mm.
that. So I think that anticipatory education of the childbearing person and the family is really, really important, to
Mm-hmm.
let them know that no, we're not expecting this to happen, but we want to be prepared with it is. Because I think sometimes what happens, especially like in the low risk that you're talking about, where we're not expecting anything, because of that, it becomes so overwhelming that, okay, well,
Mm-hmm.
now you're trying to do all these interventions and assessments that I don't need. Like, no, we want to do the assessment. We're not trying to do anything untoward. We just want to be ready to minimize what potentially may happen if we see something. So
Okay.
I think that's really important. I think that's how we kind of have to look at that. So when I think at any point in time we can educate on that.
Absolutely. I think that you made a really good point. Education is key, and building also trust with, the client,
Hmm.
with the care provider, because if we are able to really, without, stoking fear, when we're just really explaining, why certain things might be coming up,
Yeah.
and so without fear mongering, like, ooh, now it's everything scary. No,
Yeah.
but so the
Yeah.
client then trusts us too
Yeah.
when we really have
Hmm.
to jump into
Hmm.
action, or some interventions
Yeah.
are
Yeah.
necessary.
Because the last thing you want, is them saying, well, I didn't know I was at high risk. I didn't know I
Yeah,
had a risk for this. What is this?
right.
You
Yeah.
you can manage that assessment very discreetly and,
Mhm.
but I
Yeah.
think we don't talk, it's not trying to scare, it's just trying to
No,
make you aware,
aware. Yeah,
you know.
that's absolutely. Now let's talk a little bit about measuring blood loss, right?
Hmm.
And about different scenarios here. We all have, measured the or weighed the Chuck's pads,
Hmm.
but it also depends a little bit on the, birth environment. I
Hmm.
always, we always find like the water birth, beautiful as it is, but
Yes.
blood loss measuring in the water is kind of difficult. So tell me a little bit about about that.
Kind of impossible, actually, really. I mean, you can't
Yeah.
really, what are we going to do? Weigh the tub beforehand with the water in? We can't do that.
Yeah.
I think really thinking about, being mindful of the things that we can do. We
Hmm.
nearly almost, no matter what environment where our people are giving birth in, we know we're going to have drapes, we're going to have pads. We can automatically know always that if we're using the same one, this is how much that weighs. Having
Hmm.
a list there that's saying, this pad weighs this weighs this sheet weighs this, having that standardized list. We did that with one of my students as a project one time, my undergraduate nursing students. We said, well, okay, when you go to clinical today, one of the things we want you to do is we want you to weigh all the different things and come up with this list. And
Right.
then, just really having everybody who's involved in the birth being ready to say, okay, we're going to put anything that's got blood on it aside. And even if we don't weigh it right at this minute, we're going to put it in this one spot to weigh it and then add everything together. So I think you can start with those really simple things. Of course, if you do
Hmm.
have access, to the underbuttock drapes that have the calibrated container in it, we can know how much generally, we know we're going to use the whole bottle of saline maybe to irrigate with. It really starts with the education of everybody who's involved in the birth, of understanding what the bits and pieces are that contribute to
Hmm.
that. So although it may not still be fully accurate, we're not talking about accurate, we're talking about quantification. So
Yes.
the closer we can get to that, the better. The lap
Okay.
sponges, the different things, and just put that aside. And even in that birth, say, the water birth, where we can see the water, we can tell how dark it's getting, but also encouraging, number one, you've been in the water for a while. Let's get out. Let's at least get where we can get you dry, the baby dry, and then have
Hmm.
better visualization because we talk about how the environment, you really can't guess what's in the water. You can tell when
No.
there's a lot because we've all
Yep.
seen that where it's a lot
Yes.
really quick. So There's little things that you can do. And like I said, we're talking about quantification. We can't ever say we're 100% accurate. That's not something we can do, but we can certainly make those measures too, that even if this point in time, there's nothing going on, but after the
Mhm.
birth, we measure that. So then, even if 5 hours later she starts bleeding again, we truly have a better
Mhm.
idea of how much was lost at birth versus now.
Absolutely. Well, thank you. That's really great information. Helen, before I let you go, what are your hopes that our viewers will gain from watching your presentation?
Well, first of all, if you're not doing quantification of blood loss, you really need to be the champion and go out there and start that in wherever you are. And secondly, really thinking about, are you doing drills and training with the different
Right.
people who potentially would be involved in that? Because we know the research supports that if we do this, simulate it, whether it's high fidelity or not, or just practicing, even if we don't
Hmm.
have the fancy simulators and all those things, practicing what's going to happen. We know that when that event occurs, everybody is going to work much better together as a team and things are going to flow better for the good outcome of the patient.
Beautiful. Well, Dr. Helen Hurst, it's been such a pleasure having you back here at Gold, and I'm looking forward to your presentation.
Thank you so much.
And now some information for our viewers. If you have been curious now about this wonderful presentation and want to learn more, we invite you to go to goldmidwifery.com. There you'll find this add-on package where Helen is part of, but you also find our midwifery conference that we get started with. On February 2nd, we have a free keynote presentation that you can sign up for. It's absolutely open access. Please share that with your friends and colleagues in the field. And we hope to see everyone at the conference. Bye bye, everyone.